Hi everyone, it's really nice to see you all, and thank you so much for having me join you today. As Sarah said, I'm Sadeja and I'm the Patient and Public Involvement and Engagement Officer for what's known as a central team within HDR UK. So apart from the fact that means I may have one of the longest job titles in my team, my role is very much to run and oversee patient and public involvement and engagement activities within the central team, but also have oversight of activities across the whole HDR UK Institute. So I will try my best to explain how it all fits together as we go on. But I will say I could spend a whole day just talking about one section. So this is very much a brief overview. And I'm more than happy to answer questions either at the end or even after the session. So I thought, let's start off with who are HDR UK. So HDR UK was launched in April 2018, and our mission is to unite the UK's health data to enable discoveries that improve people's lives. The population's health data is so diverse, and it really does provide an opportunity to drive innovation. So what that means is that we work in partnership with the NHS, with industry, with researchers, and of course patients and the public to provide safe and secure access to health data. We are a convener and work as one single national institute. There are a lot of fancy words you'll find, but what that really means is that we bring together different themes and organisations who fall within the HDR UK umbrella. We are funded by 10 different organisations, including the Medical Research Council, Wellcome, UK Research and Innovation, the British Heart Foundation are just a few. However, one thing I really do want to emphasise is that whilst we facilitate the safe and secure access of data, we do not hold any data ourselves. We are not a data controller or a data custodian. And so whilst we may work with those who do, we do not hold the data. We often get requests to access data, and people ask us what kind of data we hold. So it is a constant kind of reminder to people. So if there's one thing you can take away from my presentation, please spread that news. So Health Data Research UK is the only national institute of health data that includes England, Wales, Scotland and Northern Ireland. We were established to work with a wide range of health data from the NHS, universities, charities, and more recently, we're also seeing an increase in data from wearables and private companies too. So to establish the kind of health data research infrastructure, our aim is to unite the health data, improve the health data, and use the health data. Different teams work within each of these areas, and then the central team, of which I am a part of, supports all of the different areas. So I thought I'd give you a really brief overview of the different areas and also really emphasise where the multi-omics work sits as well, so that you have a bit more of an understanding of how it kind of works together. So let's start with uniting the health data. As the name suggests, it's about uniting health data to enable safe and secure access of health data. So within this area of work is the UK Health Data Research Alliance and the Innovation Gateway. The Alliance is a group of data custodians. So data custodians are people who hold data, who work together to offer the opportunity for researchers or innovators to access rich and diverse health data, but it is done in a trustworthy and ethical way. On the other side of things, there's the Innovation Gateway, which kind of acts like a portal to enable researchers and innovators to discover and find out about the UK health data sets that are available. So if you go onto the Gateway, and I'm more than happy to show you what it looks like, it provides information about the different data sets that are available, and all these data sets are held by members of the UK Health Data Research Alliance. So this information could include a description of the data set, the size of the population, the legal basis for access, the process in which you would need to access the data, things like that. But ultimately, the work we do through the Alliance and the Gateway needs to be in a way that earns the trust of patients and public, which is why it's so important to us that we involve patients and the public in this area of work. We can then move on to improving health data. So this is all about providing the tools, the methods, and really the national expertise in improving the quality of health data for use by researchers and innovators. So this could be using tools and methods such as analytics, or work with our 8 health data research hubs. So these 8 data research hubs are at the bottom here, and they include gut reaction, which kind of looks after IBD, inflammatory bowel disease data, Breathe, which looks after respiratory health data, DataCan is cancer data, DigiTrials is around clinical trials data, Insight is around kind of eye health, and then we've got the BHF Data Science Centre, and that one looks after cardiovascular disease, and the reason it's got BHF is because it is funded by the British Heart Foundation. And then applied analytics and human phenome are kind of tools that can be used to improve health data. But the one which may be most applicable to you is using the health data. So this area of work looks at the different research priorities and enables research and innovation by offering new and exciting approaches to health data use. So as well as actually kind of being able to use the health data for research, our training program to train health data scientists to really grow an expert group of national research leaders in health data science also falls within using the health data stream. Just sticking within the kind of using health data, there are different sites across the UK, and this includes Scotland, Wales, and Northern Ireland, and of course Cambridge. And we see teams working across these sites to focus on key priorities. So each priority has a lead that is in a different sites, but there are projects within each priority that sit across. So for example, with the multi-omics work or understanding causes of disease, whilst the leads may be in Cambridge, there are projects happening across the different sites, such as London, for example. So it's about how can we collaborate and how can we bring people together. If we look at continue to look at the using the data side of things, there are different priorities, and these are understanding the causes of disease, better, faster, and more efficient clinical trials, improving public health, and better care. So the Better Care programme is actually still in development, and its aim is to improve people's lives by equipping clinicians and patients with the best possible information that uses data to make information about their care. So in December last year, we had announced 2 opportunities for organisations across the UK to submit bids to enable better patient care through the use of health data. These organisations have now been awarded funding, and they are one is based in the north and one is based in the southwest. So we're really adding to our number of sites, which is great. But what's really great about that one is that they really do see the value of patient and public involvement, and right from the very beginning, they've had their patient and public involvement plans embedded into their application, and some of them are currently recruiting at the moment. So I can definitely share information with you if you are interested in more of that. Hopefully that gives you a taster for the different areas of work, and it is a lot of different areas of work and something that has grown significantly. As you can see from this slide, there has been a huge growth from our launch in 2018. So as well as growing the number of research sites and organisations, we've also grown the number of data custodians who sit under the UK Health Data Research Alliance. We've also grown the number of patients and members of the public we involve. So on this slide, you can see that it mentions the Public Advisory Board and Then in 2020, our COVID-19 group, of which some of you are members, so it's great to actually kind of see your faces and meet you. But in fact, the number would actually be much higher as more and more of the research themes and hubs are recruiting their own panels. And for example, this slide does not take into account your amazing group. So I'm sure this will just continue to grow as well. But before I briefly touch on our patient and public involvement and engagement activities, I just wanted to show you how the kind of governance structure works at HDR UK, because I know it's something that a couple of people had asked for. So as you can see, we have two delivery groups down here, the improving and uniting data and the using data delivery groups. Both of these have lay members who are involved in making strategic decisions. And then we also have two advisory boards over here. The International Advisory Board does have a patient or public on there, and they met for the first time to really provide the international perspective and advice. And then we've also got our Public Advisory Board over here, who feed in directly to our executive group, and were established in January last year, so January 2019. And I really believe that the work of the Public Advisory Board has just raised patient and public involvement and engagement higher on the agenda for HDR UK, and so they really have been a kind of driving force in ensuring that our work is driven by delivering benefits that are for patients and members of the public. My role started in January this year, and before I started there wasn't a dedicated patient and public involvement role for the central team. And I think the fact that the Public Advisory Board achieved so much in that year before I started really demonstrated to key members of staff, especially in senior positions, the benefits that can come from patient and public involvement. And by kind of committing to and actually hiring a full-time member of staff, I think it's just shown their commitment by saying we do want to invest in this, which can only be a good thing, and even better by the fact that it was kind of pushed forward by the Public Advisory Board. So as I said, I started back in January this year, and one of the priorities was to establish our strategy and approach for patient and public involvement and engagement. So this was a process that took quite a few months, quite a few consultations with different groups of people, but we ultimately developed a communications, engagement and involvement strategy. There were a lot of changes that were made to develop this, but what remained were our 4 goals, and this was to patients and the public are our partners in design and decision making, that the needs and interests of the public are understood and embedded in our work, that people have the trust and confidence in the use of health data for research and innovation, and that people want their data to be used in research. Over the next year, there will be a number of priorities for our patient and public involvement and engagement work. So I've just outlined a couple of these just to give you a little bit of a flavour of it, but I can definitely talk to you about it a little bit more as well. So one of these is ensuring involvement in the development of our data access work. Data access is one area that poses the biggest risk for public trust. So we'll be looking to involve a wide range of people in this. So if you are interested in getting involved, please do get in touch. I just wanted to do my plug there. We're also looking to redevelop and refine our public facing section of our website. If you've been to our website, it can be a little bit confusing, I will admit that. I kind of said it in my own interview, and then I stepped out and I was like, oh, why did I criticize that? But it was a good thing, because it just showed there is definitely room for improvement as well. So again, if you have ideas on what this could look like, I'd really be keen to hear some more. Related to that, we're also developing a communications plan that is specific to patient and public involvement and engagement to showcase the impact the patient and public voice can have in our work and help extend our reach. So this will not just be the central team, it will be across the whole institute, across all the different panels and groups and things like that. So it would be great to have this group as a case study or something like that as you begin to grow. I'll also be looking to do more to increase the number, but also the quality of involvement and engagement activities across the institute. because it is a real mix. Some are doing really, really well and have established their groups like yours, whereas some are kind of a bit, let's say, early in their journeys. So I really want to ensure that I can kind of connect people with the different themes and organisations that make up HDR UK to support them. And lastly, but no means least, and actually one of the things I'm most looking forward to, is implementing a patient and public involvement and engagement network. So this would be both for the people running the activities and also those who get involved. I hope that it will be a chance for people to meet each other, to share ideas and best practice, and also look at ways to collaborate. I think it's also important to develop it as a support mechanism and way to brainstorm ideas to barriers or issues that apply to a few different teams, such as ensuring inclusion when running online events during this pandemic, an example. So this really was a very brief overview. I had been here for like 6 months before I even knew what the Alliance was. So I really could have spent the whole day talking about the different aspects of HDR UK, and it still really wouldn't do it justice. I really am more than happy to discuss further outside of the meeting too, but we thought it would be good to have some time here. So I will pass it over to you to see if you have any questions or anything you'd like to talk about in more detail.